therapy is a waste of time. Yeah, I said it.
Well, then I gotta say, Shay, are you a narcissist? What is going on, fam? Thank you very much for tuning in. Today, I want to be talking about Shay RowBottom's video talking about how talk therapy is bogus. Now, I want to make it very clear that this is in my professional opinion, my experience in the human resources realm, as well as the mental health industry. Not only that, what I do on the side for career consulting. A while back, Shay RowBottom released a video stating that talk therapy is bogus. Now, the first thought that came to my mind when she said that talk therapy is bogus, the question is, what was she looking for therapeutic services for? And two, what kind of therapy was she getting? So for example, if it was depression, anxiety, if she was going for solution-focused therapy or maybe cognitive behavioral therapy, she is going to be doing a lot more talking than a lot of more mindfulness-based practicality training. Now, training, I say this in a sense that you would have to train yourself to be able to start thinking the way you think, act, and respond to situations. But before we dive any further, let's go ahead and see what she said.
So I went to talk therapy, traditional talk therapy by clinically trained psychologists and psychiatrists for years. Gotta say, in my experience, didn't really move the needle. I got my first consistent therapist when I was 19, and I didn't stop seeing traditional therapists regularly until age 24, when, lo and behold, a gift was granted upon me.
In essence, she started seeing therapists between the ages of 19 and 24. From there, she decided to continue on the journey or the process of following an executive coach. But I want to make this very clear. When it comes to receiving therapeutic services, there are an enormous amount of reasons why you would get therapy. So for something that is more on the baseline of depression and anxiety, I understand that an executive coach would be more geared to helping you with that, especially if you want to focus on your business problems. But for affective disorders such as bipolar disorder, schizophrenia, major depressive disorder that is constantly recurrent, ADHD, dyslexia, dysgraphia, dyscalculia, even something that is pervasive such as borderline personality disorder. It really depends on what kind of therapy you're getting. So if therapy failed for you, Shay, well, I mean, of course, we have to ask if you're a narcissist, because if you find that therapy didn't work for you, even with the psychiatrist, Shay, didn't you know that a psychiatrist is only for medication management? Ladies and gentlemen, if you're paying attention, I want to tell you exactly how I can extract what she's saying and apply it to your life. Shay, if you have never had kids before, or if you have had kids, did you ever suffer from postpartum depression? If you have an employee right now, and she is your right-wing woman, and she goes on maternity leave, FMLA Act, or whatever the case may be, she comes back 2 months later, and she's not performing the same, did it ever occur to you that maybe she has postpartum depression? How would she approach that to you? She would probably have to ask you to go see a psychiatrist to get on the right meds. Because if she is suffering from postpartum depression, maybe there's also an underlying factor, if she's undiagnosed, that she has bipolar disorder. Did you know that you cannot give an undiagnosed bipolar patient antidepressants? You want to know why? Because you would send them back into a manic state. Guys, I want to tell you exactly what I have, because it's allowed me to perform at such a more optimal level in my life that I don't want you to think that this influencer or content creator is telling you to drop your therapist. If you need an executive coach for your business, focus on that. But if you have recurring depression, bipolar depression, post-traumatic stress disorder, let me give you a few options of what other therapies you can find.
Through my last investor company I worked with at my last agency, I got assigned an executive coach. Sounds like someone you talk to about all your business problems, right? Oh, no, we went deep. We talked about the root of why I even have business problems. This woman was brilliant, and she was like 33, never went to college for this, didn't have any fancy credentials or even real training for traditional therapy. therapy, but was extremely self-taught in the mental health personal development space. And the questions that this woman asked me, way better than any therapist I'd ever been to. Like seriously, she was so much more effective right off the bat. Not only asked better questions and understood trauma at a fundamentally deeper level than those college educated, but because she wasn't a traditional therapist, she could talk about her own experience too. Dude, game changer.
There is solution focus, there is dialectical behavior therapy, there is cognitive behavioral therapy, there's mindfulness therapy, there's biofeedback electroconvulsive therapy, there's also medication management therapy, which you're going to see more from an advanced family nurse psychiatric practitioner, or you're going to see from a psychiatrist. Whatever it is that you do, you have to ask yourself, what is your problem? But let's go ahead and see what Shay has to say.
We could talk, like we could just have a conversation. She could actually be like, oh, I'm messed up too. Let me tell you a little story about me now. Oh, I don't know why no one ever thought it might be okay for a therapist to say that to their patient. So end rant on my beautiful executive / life coach sent from heaven.
And as you can see, it was a rant. It wasn't even a prescription or a recommendation. When it comes to your therapist, it really goes into what your therapist is willing to reciprocate back to you, the patient. I have 3 therapists. I have a psychiatrist, I have a family therapist, and I have an EMDR therapist, which is really good for trauma processing. As you guys already know, I have my diagnosis, which you can find in one of my later videos. But that doesn't account for that I still hold the responsibility to make sure that I take my meds. Now let me tell you exactly what an executive or life coach can't do. For something that is pervasive as bipolar disorder, and a lot of you are undiagnosed. Those of you watching are undiagnosed bipolar. I know this for a fact. How do you tell your boss that you have bipolar disorder or postpartum depression or ADHD or dyslexia, dysgraphia, dyscalculia? Maybe your girlfriend broke up with you, or maybe you lost your mom and you're really grieving. How the hell do you tell your boss that you're having a really mental health problem right now? Most of you don't know how. This is why I create this content. I'm going to tell you a little bit of what I do for myself, for my psychiatrist, that allows me to stay sane and produce this content for you, as well as hold a full-time job, have a side hustle, as well as do everything that I possibly can to ensure that I don't become a rule, I'm not a statistic, and I become the exception. The 3 medications that I take for bipolar disorder: Depakote, Trazodone, Seroquel. That is for my medication management to ensure I don't go into a manic state. That also means that I have to watch what I eat and I can't drink alcohol. So for those of you who are going to happy hours complaining about your job, complaining about how your life sucks and the bills and the family and the car note and all this stuff, a life coach is not going to help you with that. You probably need to see a shrink or probably detox. You also probably need to get a therapist. And if you're having problems with your marriage, get a family marriage counselor. Jesus, it's not that hard. Also, when it comes to my attention, as you can see that I have ADD, I need to get Adderall. A life coach can't do that for me because you need to write a prescription. I can't focus because I have attention deficit hyperactivity disorder. I didn't wake up saying, hey, I want this. It's a neurodevelopmental disorder. Not only that, I have spine bifida. So when I was going to my chiropractor, they said, hey, your spine's not connected. Are you constantly in lower back pain? Yeah, I thought it's just the way I said. Well, it turns out that you don't have the best spine. It's not made all the way. It's off. So I have to take a Robaxin to be able to make sure that I can reduce those muscle spasms when I work out. On top of that, I also have a panic disorder. Why? Because I suffer from intense amounts of trauma. So in order to reduce those panic attacks, I have to take Buspar as well, which is great because it's not like Xanax. And if you don't have a bad reaction, it's actually really good because you don't get this addicting feel. Guys, for those of you who are suffering from a mental health disorder and you're reluctant to tell your boss, do not follow what Shay RowBottom says. In my opinion, of course, that traditional therapy is bogus. Do not invest $2,000, $3,000 of your savings because an executive life coach can help you with your problems. Go find a traditional therapist. Make sure you ask questions, become educated, and don't stop moving forward. That is just my 2 cents. You know where to follow me. Until next time, guys, stay tuned. Take care.